Hi, how are you? I'm fine.
The Elder Women's Initiative grew out of work that the California Endowment and UCSF Institute on Health and Aging in 2007 did a Women's Health and Aging Building a Statewide Movement report for diverse elder women and their allies to come together to really be able to share with each other what they see as the unique assets their communities have to offer, as well as challenges and recommendations, and really to be able to connect advocates.
What we're hoping to do is to strengthen, to revitalize the movement where appropriate, and to ensure that people who've really perhaps been on the margins of that movement in the past are really part of that movement.
So in structuring the Speak Out, a portion of every Speak Out has been an opportunity for any woman who has come to provide testimony.
My clients are primarily women over the age of 75 who live alone. They just sit at home and watch television, and they die without anyone really even noticing. What I think we really need to do is we need to start looking at housing options for single elder women.
I'm a former prisoner, and I can tell you that some of the most painful memories that I have of incarceration are remembering the sight of semi-paralyzed older women struggling to get their wheelchairs into the dining room.
With the Cambodian communities is that our elderly are now starting to experience some solitude moment in our community. We have a temple to go, but we have about, our temple is about 13 miles away from, one way from where we live. The Cambodian go temple almost every day when you retire, when you get into that age in Cambodia, but here three times a year. So that is the problem. And we wanted to do something about it.
We also wanted in every one of the Speak Outs to hear from a leader who understood the needs of an aging population, so we always had a keynote speaker.
So if we are to ensure that services to seniors are maintained, we need your advocacy today more than ever. And we need it today more than ever because women who are aging are at greater risk of being affected by these cuts.
And this past year, we partnered with UCLA and Wider Opportunities for Women in DC to release new data on what it costs to make ends meet for older adults in each county of the state and in many states across the country. The federal poverty line, which determines who gets access to our public supports and who gets denied. The line which decides which communities benefit from our state and federal resources and which communities get left behind, is based on a one-size-fits-all measure, drawn from 1950s data. According to the federal poverty line, individuals, whether they live here in LA or Topeka, Kansas, are expected to live on about $10,000 a year, far below what we're finding it really costs to make ends meet.
We thought that we could really talk about the strengths that elders bring to families, to communities, if we could hear about that from non-traditional voices, through the voices of youth.
I guess the person I chose, my elders, my mother, she grew up in a very sort of faithful culture. She came from El Salvador, raised 4 kids here, a whole war era.
My great-grandmother, 87, I think, born and raised and died in Berkeley, California. She lived in the same house for 44 years, and not only raised me, but she raised my mother as well as her own children. So she really was the matriarch of our family.
My grandmother's name is Clara, and this woman is a very strong woman. Any person that can deal with an abusive husband and still raise 6 wonderful children is extraordinary. What's even more extraordinary is that she didn't stay and allow the abuse to run her life. She took command of her destiny. My grandfather constantly beat her and their children just because he was filled with alcohol, rage, and guilt.
My great-granny is the only woman I know as my mom. I call her my granny and my G-thing. She took care of me when nobody else did. She never gave up on me. She always taught me in life that there's never a wrong, but I know I do wrong. I'm not always an angel, but I'm an angel in her eyes.
And finally, we wanted to give every attendee the opportunity to talk for themselves about their strengths, about their needs, and so we structured it around a roundtable conversation format that could bring forward recommendations that then will be published in a report.
Now, if you want to change any of these questions, our recorder will be flexible.
Some of that early education needs to be policy and procedures about the different things that are out there.
No, doesn't have where you're starting.
At a fundamental level, believe that we change people's hearts and minds when we hear people's real stories. And so this is why this testimony is invaluable for me personally as I listen to how women's lives really are, but it's also invaluable to policymakers. We have to be the conduit for these stories because it's the realities of people in their communities that really move people to action.